think I was most interested in becoming a psychiatric nurse practitioner via just recognition of the need through the community and knowing that there weren't resources. Unfortunately, when I was in nursing school, there was still a lot of stigma. I mean, there's still a lot of stigma today. Let's be real about that. But the stigma was just overwhelming to the point that there was a definitive need to provide a service and a population of people who did not have a voice. And I needed to be that voice for them. And it was really my time working through Easter Seals, Wisconsin in their camps program and working with some of their campers and seeing the limitations that they had in receiving healthcare, specifically psychiatric services, that really led me to pursue the additional education to become a psychiatric nurse practitioner. My role at RAMC is the psychiatric nurse practitioner, which means that I see patients for a variety of mental health concerns. I will provide a diagnosis, do an evaluation, possibly get some lab work, possibly prescribe medications, and then also work with their family practice team to make sure that they have the most comprehensive care available. There is definitely a fear of seeking services, a fear of being kind of like classified as that person and what that means. This is an open service. This is an open opportunity for you to seek care for something that is just as much of an illness as diabetes, as hypertension, as having your regular annual exam. Your mental health matters just as much as your physical health does. The most rewarding aspect of my career is definitely when patients are doing better. They come to me at sometimes the worst point in their life, and it is never a straightforward path. It's never something where you can predict what it's going to look like or how long it's going to take. Sometimes it's years, sometimes it's months, sometimes it's just weeks, depending on the circumstances. But really having that patient come back and say that I'm doing better, that I'm able to now go back to work or enjoy time with my kids or my pets or whatever they may have as that value point in their life is so rewarding and just amazing to see happen from different influences that I've been able to have on them. Coming back to RAMC for me was a chance to come back home again. I had been here for 17 years in the past, and leaving was not because of anything that was happening here, rather just an opportunity to serve another community in a different way. And again, that recognition of mental health services, the need for mental health services, and also the very open, large need for having a provider in this community was the reason that I came back. And we now have an opportunity to grow these services with myself and the other members of the behavioral health team who are still going to be joining us. And so I feel incredibly fortunate to be back within this organization and being able to help another community to combat stigma and find the access to prescribing services that they've been missing. I teach for UW-Madison. I am a clinical associate professor. I am incredibly invested in not only providing behavioral health services, but also in training the next generation of providers who are also going to be doing this work. And then at home, I enjoy photography. I also have a very unique hobby of raising monarch butterflies and helping to combat the loss of the population and the near extinction of that particular insect. And so all summer long, my son and I will walk the roads of our rural community and look for eggs and baby caterpillars, and then we will keep them in a safe habitat until they are able to be released. And typically in a summer, we're releasing anywhere from 100 to 200 monarch butterflies so that we can help keep the population growing.